Hey everyone, welcome back. Ready for another deep dive.
Always.
Today we're going deep into the world of diabetes and depression,
Right.
specifically how they're connected and
Yeah.
potentially how this therapy, cognitive behavioral therapy, CBT as it's known, might help.
CBT.
Now, the jumping off point for today's deep dive is a fascinating study by Ajele Deacon,
Okay.
published just this year, actually, 2025, in Primary Care Diabetes, called Targeting Depression and Diabetes Comorbidity.
Oh,
And
interesting.
they really looked at the research, a lot of different research, about CBT and how it impacts folks who are dealing with both of these conditions.
Yeah, I mean, just intuitively thinking about it, it makes a lot of sense that there would be a connection, right?
Oh, yeah?
Like if you're really struggling with depression, I imagine it's pretty tough to find the energy and motivation to
Right.
manage your diabetes effectively.
Yeah.
Maybe staying on top of your medications, making healthy food choices, all that stuff probably feels way harder when you're feeling down.
Yeah.
And then on the flip side, if your diabetes isn't well controlled, that can lead to all sorts of other health problems,
Right.
which I imagine could make anyone feel pretty anxious or
For
depressed.
sure. For sure.
It's that kind of vicious cycle, right?
Yeah.
One thing feeds into the other,
Yeah.
and
One feeds the
it
other.
just keeps spiraling.
So it's not just a coincidence that these two conditions show up together so often.
Right, exactly.
It's like they're actually, like you were saying, feeding into each other.
Yeah, they can really worsen each other,
Yeah.
which is what comorbidity is all about, right?
Right.
Two chronic conditions hanging out together and not in a good way.
Not in a good way.
Yeah, not in a good way at all, making each other worse.
Yeah, so this brings us to CBT,
Right.
cognitive behavioral therapy,
Right.
which on the surface sounds like, okay, well, that's something for mental health.
Yeah.
How could that possibly help with a physical condition like diabetes?
Yeah, that's a great question. And it might seem counterintuitive, but when you really think about it, CBT can actually play a huge role in managing chronic conditions, even physical ones like diabetes.
Yeah.
Because at its core, CBT is about identifying and changing negative thought patterns and behaviors.
Right.
And those patterns and behaviors, they can absolutely impact how well you manage your diabetes.
So how does that actually work?
Well, think about it. Managing diabetes takes a lot of self-discipline, right?
Right.
You've got to be really diligent about monitoring your blood sugar, taking your meds, making healthy food choices, getting enough exercise,
Right.
all that good stuff. And if you're struggling with negative thoughts like, I can't do this or what's the point?
Yeah.
It's going to be that much harder to stay on top of all those things.
Right. It's like it's almost setting you up for failure, those thoughts.
Exactly. And that's where CBT comes in.
Okay.
It helps you challenge those negative thoughts.
Okay.
Replace them with more positive and realistic ones, and develop coping mechanisms for those really tough moments.
So it's like CBT gives you a different way to look at things.
Exactly. And a different way to react to things.
Okay, so give me an example.
Sure. Let's say you have a habit of stress eating.
Ooh, yeah. Guilty.
Right. We've all been there.
Yeah.
So your blood sugar's a bit high, you're feeling stressed about it, and you automatically reach for that bag of chips.
Yep. Sounds familiar.
Right. But with CBT, you start to recognize that pattern.
Okay.
You learn to pause, identify that thought, I need those chips to feel better,
Right.
and then challenge it.
Okay.
Is that thought really true? Or is there a healthier way I can cope with this stress?
I see. So it's about breaking that automatic, almost like a knee-jerk reaction.
Exactly. And it takes practice, but over time, you can retrain your brain to respond differently.
Fascinating.
And that can make a world of difference in managing your diabetes.
So this Ajele Deacon study,
Right.
it didn't just look at like one tiny study on this, right?
No, it was a meta-analysis.
Right.
Which means they pooled data from a whole bunch of different studies that looked at CBT and diabetes.
Okay, so that's like a really powerful way to get a clearer picture of how well something works.
Exactly. It gives you a much more reliable and comprehensive view of the evidence.
Right.
And what they found was really promising.
Okay, what did they find?
Well, they found that CBT was significantly effective in reducing depressive symptoms.
Okay, not surprising, right? That's what it's kind of designed for.
Right, exactly.
But what about for diabetes?
Well, here's the really cool part. They also found that CBT led to significant improvements in glycemic control.
Glycemic control, meaning?
Meaning blood sugar levels.
Oh, wow, okay.
So not only were people feeling better mentally, but their physical health was also improving.
That's amazing. So it's like a double win.
Exactly. It's not just about feeling better. It's about tangible improvements in your physical health, too.
Yeah, and that can have a huge impact on someone's life, right?
Absolutely. It can mean fewer complications from diabetes.
Right.
Better quality of life overall.
Yeah.
It's really exciting stuff.
It really is.
And I think it raises some really important questions for healthcare providers, too.
Like what?
Well, If we know that CBT can be this effective, should we be screening for depression more routinely in people with diabetes?
Hmm, that's a good question.
Right. And should CBT be offered more often as part of a comprehensive diabetes treatment plan?
So not just focusing on the physical side.
Exactly. We need to be treating the whole person, not just the disease.
Yeah, it's really about that mind-body connection, isn't it?
Absolutely. You can't separate the two.
So big takeaway
Yeah.
here. Depression and diabetes are seriously intertwined.
Right.
And CBT might be a really valuable tool to help people manage both.
I think that's a really key takeaway.
Okay, now I have a question for you, and for everyone listening. Given what we've learned about the impact of CBT on both mental and physical health, where do you think the future of healthcare is headed?
Ooh, that's a big one.
It is a big one, but it's something to think about.
Ah.
Should we be moving toward more integrated treatment approaches, considering both the mind and body?
That's a fantastic question, and I really encourage everyone listening to ponder that because I think it's a discussion that we really need to be having as a society.
Right. It's not just about treating symptoms.
Exactly.
It's about treating the whole person.
The whole person, exactly.
Well, on that note, thanks for diving deep with us today.
Always a pleasure.
And to all our listeners, keep those brains curious, and we'll catch you on the next deep dive.
See you next time.
Bye.